Hello, it's Dr. Christine Arseneau, PharmD Functional Medicine Certified Health Coach. And I wanted to talk a little bit about our thoughts and our perceptions about life and how that can directly affect our physiology, and just about stress in general and how perceived stress and physical stress and psychological stress all directly affects our immune system. And so stress releases cortisol, the stress hormone. And what's really most important in our body is homeostasis, is having an equal balance, having things work optimally. So it's not that, cortisol is always bad. It's supposed to be there to do a certain job, but it's about your body being able to regulate things. And when you have too much cortisol, as in stressful situations, that affects your immune system. And there's an inverse relationship between white blood cells and cortisol that they have found. So the cortisol directly, suppresses white blood cells in your immune response. And the work of Hans Selye and Robert Sapolsky, they were really looking at stress and how it affects your body. And one important form of stress that they found that released cortisol was low social status. So they actually looked at primates in the wild, and they found that the subordinates had a higher resting cortisol than the dominant primates. And so they looked at studies, and they found that chronic situations where you feel like you have low social power, low self-esteem, you don't feel valued in a social group, maybe it's your socioeconomic status or a certain, stigmatized group that you belong to, that really affects your stress and your cortisol levels. So yeah, it's interesting how that specific form of stress, that low social status, that, perceived social status of not belonging or how others perceive you, how that is directly affects your cortisol and your immune system. And then, stress does other things with your immune system, decreasing, T cell function and different things, and it causes inflammation. And so a lot of these researchers looked at, specific emotions and how they tied in, and emotions like shame really tied into that cortisol increase. So basically, the more self-conscious type of emotions elicited a greater increase in cortisol. There was one study where people were to journal about a situation where they blamed themselves to bring up shame, and they monitored their inflammatory markers, and they went up when they did that journaling and they felt that shame. And then even after they were done journaling, they didn't go down quite to where they were at baseline, because those feelings stick with us. And so what others think about us, what we perceive others to think about us, affects our cortisol levels, the inflammation in our body. And it's really crazy because it's our, perceptions, our reality. And we don't really know what other people are thinking ever. So we're perceiving something that isn't even true, and that is directly affecting inflammation in our body and our stress response and how our immune system functions. And so we all tell ourselves stories, and it's time to think about the stories that you tell yourself and if they're serving you or if they're not. And just letting go of others' perceptions of you and telling yourself a new story that is serving you can really make a difference physiologically on your cortisol levels, on your immune system, and on inflammation in your body. So yeah, that's what I invite you to do, is to just be aware of the stories that we tell ourselves, realize they're just stories, and see if you can find a story that is serving you. So I hope you have a wonderful day, and thanks for tuning in, guys. Hi, Maureen.